And third, I'd like to introduce you to one of the bravest young men I know, but also a man who's become a friend, Moise Brutus. And I think the best way to get to know Moise is to see a video about his life.
Life growing up was pretty good. What I can remember was, what every child would imagine their child to be like. Until October 11, 2010. I was in a really bad motorcycle accident where I had a less than a 1% chance of survival. I woke up from a coma 3 days later, looked down, man, I couldn't believe it. My legs were gone. My name is Moise Brutus, and I'm a triple amputee. First thing I said was, oh my God, my life is over. For about 6 months, I just stayed in a dark room and never left. At my lowest point, I was about 76 pounds. And my mom, she lost all hope. To me, I had two choices: either stay in clinical depression for the rest of my life or go out there and be everything I can be. I made the decision to not let this accident define who I would become. At that time, I had also met Catherine Martinez from WellCare, who went out of her way to give me everything I needed. Catherine and I, with the help of providers, were able to get me the prosthetics I needed to get my life back. I started going to amputee support groups, which helped my morale a lot. Just around the time I got in touch with Catherine, another big change happened. I got Dexter, my best buddy in the whole world. When I got him, we were out around the block every afternoon when the sun went down, and that was the start of it all. I also started doing outpatient rehab, and that's when I started venturing out of my comfort zone. One day at therapy, one of my therapists decided to put me on a stationary bike. I remember the whole room went quiet because everybody thought I wasn't gonna be able to do it. I work out 5 times a week. I cycle about 100 miles a week. I go to school, and I'm totally independent. My life today is amazing. I'm currently training for the 2016 Paralympic cycling team. When I'm on the bike, I feel like the wind. I feel free. I feel like I have no disability. I never thought that going through something so traumatic would lead to so many good things. Whenever I had any doubts, I've always had the support of many who pushed me through it. Someone said that the brightest lights come from the darkest places, and this is so true. Because this past year, I learned so many lessons. Even though I have so much more road to travel, this chapter of me getting back on my feet is almost done. I feel like my foundation is set for me to accomplish anything I want to.
Moise, it's great to have you here.
Thank you.
As I mentioned in the video, October 11th is a big day. And today is the 3-year anniversary of your accident.
It is.
Take us back 3 years. What happened?
You want me to explain what happened? Pretty much, I don't really like to, it's taking me back. Give me 1 second. All right, so my mom had just got back from vacation, and I get a call from one of my friends. He was like, hey, we're going to go out for a ride. You want to come? And this particular friend, I had let him down a couple of times before, and I didn't really want to let him down this time. So I decided to go, put on all my gear, headed out. Mom, I'll be back. Mom's like, no, don't go, stay. I should listen, but I didn't. And then I went out, and all I remember was seeing like a white wall when I decided to take the exit to go home. And then I just remember waking up in a ditch, look down, this leg's gone, this one looks like a pretzel, this arm was gone. Okay, my life is over. How am I gonna get out of this situation? You had a phone, had to find the phone, called 911, hello, I was in a bad motorcycle accident, my arm is missing. About 15 minutes later, I hear sirens, but I can also hear panic in the dispatcher's voice. So I'm like, okay, they can't find me. That time I started feeling really, really weak and sleepy. and she made a point to try to keep me calm and so I wouldn't fall asleep. Another 15 minutes go by, they still couldn't find me. At that time, I told them I hear and I see sirens coming from my right. If they come to their left, they'll find me. A minute later, they found me. Put the tourniquets on. That's when the pain started. Worst pain ever. Took me to a hospital. Remember this one nurse, she kept asking me all these questions. I'm like, put me out, put me out. But she just kept asking me questions. Had to yell at her a couple of times to put me out. They put me out, and remember they tried waking me up like periodically just to, access my brain function or whatever. But I just wasn't calm enough for them to keep me up because I kept asking, did they put me back together? And on the third day, they woke me up and I saw my mom, and that's pretty much where it all started.
You know, one of the things, given your experience in Miami-Dade County was in the process of transitioning through Medicaid reform at this time. And so you had the experience of being in old Medicaid for a period of time before being in a reformed private plan in Medicaid. Can you talk a little bit about the difference of what care was like when you're in old Medicaid and how you interacted with patients, and contrast that to your relationship in a private plan where the incentives are focused on improving your health, and a little bit about Catherine?
Well, in my opinion, the old Medicaid, I feel like, like you're just another number, pretty much. And I mean, I don't even think it's really their fault, because they have so many cases, and there's so many people. Everybody has their own problems. During that time, my mom, she's not a nurse, but she's something close to a nurse, I think like a CPN or something like that. And at that time, my mom had to change like my wounds and stuff, because I didn't get anyone to come and remove them. It was really, really bad. When I sort of transitioned to WellCare, it almost didn't happen, because I remember Catherine, which she deserves some credit for me being here today. She made it her incentive, and she worked for WellCare. She made it her incentive to get in contact with me and my mom, because at that time I wasn't picking up any of my phone calls. I was in a really, really bad mental state. I would just sleep all day. And I guess she read my case files once everything got transferred over to WellCare. She read my case files, and she made it a real interest to be proactive. And since she couldn't contact me, she contacted my mom. And moms being moms, my mom was able to explain everything to her. And she made it her #1 priority to get me everything I needed. And that right there made so much difference, because I think the ultimate goal is, of course, one of the jobs of government is to provide health care for the nation's population. But I mean, you don't want everybody to be, like on Medicaid, or else taxes are going to have to go up. And no one wants that. I mean, I don't really know all the political terms and stuff, but just from my point of view, I feel like, Medicaid, food stamps, and all that other stuff, it's sort of like a cushion blanket for like when something goes bad, which 9 times out of 10 it will. Just something to, keep you going until you figure out that next step. And for me, this is my 3rd year. Training for the Paralympics. I'm going to school. I'm not going to be on this thing forever. It's for me, it's just, it's just like, for me, it's just like a cushion for me to finish my schooling and go back to the job market, and start paying taxes again to help our other fellow Americans. And the way WellCare was able to do that is because old Medicaid is sort of like, they give you a list of things that you're able to get. And everybody's different. Like, I'm different. I'm really active, all that kind of stuff. So something that works for someone who's 67 might not necessarily work for me. And WellCare realized that because one of my legs, I kept, breaking them because of my activity level. And every couple months, they would have to shell out approximately $15,000 every couple months because I kept breaking it. And what they were able to realize is that, okay, so if we get him a better leg, which costs maybe, I don't know, 50 or 30,000, we'll be able to save this much money throughout the whole year because he won't be breaking this leg every couple months or so. And WellCare and I guess the other companies sort of realize that, and they sort of have like an individualized plan where they can assess your situation, and with a doctor, that's overseeing everything is able to make recommendations on what's really best for the patients, for them to go out there and figure their lives out and go back to workforce, I guess.
So Moise, you're telling me you're one class away from getting your associates in chemistry, which I can't even begin to tell you.
2 classes.
Oh, 2 classes, sorry. So I don't even want to tell you how I did in chemistry. And you're training for the 2016 Paralympics.
I am.
We have a room full of policymakers who are considering taking on what it really is a big public policy challenge, Medicaid reform. So given what you've gone through, what would you say to the policymakers in this room to encourage them to take on this big public policy challenge?
I would just say that there are probably thousands of other people just like me out there. All they really need is just like a little boost. And if they're able to get the things that they need and, get the care that they need, I'm sure, sooner or later the state will have a lot of healthy, young, maybe even old, just, working people back on the workforce. And, that's pretty much it. And just try it, if it doesn't work, you can always go back to the old one, but just try the new one.
Thanks, Moise.
No problem. Thank you. Welcome.